So let's see how do we do the implant planning of our patients at Ivory Dental Clinic. First, the patients come for a consultation with me, that is Dr. Vishwas Madan, an implantologist having 13 years of experience in implants. Then we take a CBCT scan, which is present in the clinic itself. So patients don't have to go out or search for any diagnostic center anywhere. We have this facility in-house with a good FOV of 8.5 by 13.5, a beautiful machine, a German machine from Dental. Then we check the CT scans in the software and we start our planning. So in this software, what we can see is now the whole dentition of the mouth in one go, and we can visualize the patient's bone condition and the gum condition in three-dimensional views. And we can take all the different sections which are required for planning for the implant. For example, here I'm planning for Mr. Vijay an implant placement extraction with tooth number 31324142, and now I've opened a sagittal section view of this case, where we can see that there is a lot of bone loss and we have to remove these teeth, and after removing we need to place an implant. So this is the particular tooth and I'll be placing the implant somewhat over here like this. So let us see, I'm placing the implant virtually first. This is like a mock surgery before we actually do it on the patients. The treatment becomes more predictable. So that's how I intend to place the implant in the bone for tooth number 32314142. And now let me go on to the next tooth and show you how we do the implant placement for this site. Okay, that's it. So this is the planning, and then on top of this particular area, a new tooth will come like this. All right. We can actually visualize the exact outcome of the surgery even before the surgery has happened. We can exactly visualize how we are going to place the implant, how the surgery will go, any complications which we are going to see, or any kind of adjustments which you want to make in the implant angulations, the size, the fit, everything is planned beautifully in this software. And now I'm going to show you post-operative view of implant placement. So this is what we had planned, and now let us see what is the final view position. So now in this scan, we have taken this post-operatively, we have done the implant surgery as we had planned. We had placed the implants inside. In the 3D view, you can see these implants over here. And let me show you in the sagittal section, in the OPG section, these are the two implants which are completely parallel to each other, placed beautifully. Immediately after the extraction is done, we have been able to place the implant in the exact angle as was planned. So this is the great benefit of having CBCT in the clinic itself. Before the extraction, we can plan what is the size of the implant, what is the angle. Then we can do the surgery, and within 1 hour, we took the CBCT scan again to verify whether we have placed it correctly as planned. So we can see it is perfectly placed, and that's how technology helps and Ivory Dental Clinic for the betterment of our patients. Thank you.